Hey everyone, this is Jonathan Marx from Go to Health. I hope you're having a great day. Today we're talking about the health of your teeth and how the health of your teeth affects the health of your body. Now, most adults say they would do almost anything to save a natural tooth. Studies also suggest that treating dental infections, including with root canal therapy, may be associated with improvements in overall health markers such as blood sugar control, cholesterol, and inflammation. Yet only 36% of respondents recognized that a root canal could potentially benefit conditions beyond the tooth itself. Today, we're talking with Dr. Craig Noblett, president of the American Association of Endodontists, and he can discuss why saving natural teeth matters for both oral and overall health, the connection between dental infections and whole body health, and what patients need to know when something doesn't feel right. And if you want to learn more, you can go to AAE.org. That's the American Association of Endodontists. So welcome to the show, Dr. Craig Noblett. How are you today?
I'm doing well, thanks. How are you?
Good, I'm great. So tell us, what's the connection between the health of our teeth and our overall health? I think people usually think our teeth are just independent in our mouth and somehow not connected to the rest of the body.
Well, they're definitely connected. I think the connection with your overall health first starts with your nutrition. I mean, your teeth are how you chew, and your food is where you derive your nutrition. So if you have a problem with your teeth and you're not able to chew, that can affect your health, your energy level. Also, if you have any infection or inflammation present in your mouth, that can affect your systemic metabolism. In fact, there's a recent study that was published earlier this year from King's College in London that showed that timely root canal treatment can actually reduce your risk of heart disease and diabetes. So maintaining your teeth is important.
And what's the connection between, let's say, having healthy teeth and heart disease? I don't quite understand that. Do we know?
I think it's more to do with any site of inflammation or infection within your body taxes your metabolic resources or your energy level. So if you have something that needs to be fought off, if you will, it would somehow distract your body's immune system from taking care of other routine functions.
Got it. So I would assume that most people want to keep their natural teeth. What's the advantage of keeping our own teeth versus losing them and having replacements?
Well, again, if you think about it, your natural smile is part of your self-image. It's a part of your personality. So your appearance is one advantage of that. Mm-hmm. The other is maintaining your teeth so that you can chew properly. And also your speech is affected by the presence of your teeth. So all of those things can be impacted when you lose a tooth, and it can actually adversely affect someone's self-image. So we like to keep them in there if we can.
Good. So if we have to have teeth replaced, does that affect our health? And how good are those replacements these days?
Well, they're good. I mean, they are good, but they're not the same as your natural tooth. They'll feel different. It takes a lot longer to get to that point where the tooth is actually replaced with, say, an implant. That can take several months after a tooth is removed. And during that time, it's possible for the adjacent teeth to shift in position. And that can change your bite. Again, it can change the way you speak. So we really want to try and keep your teeth in place. And the best way to do that is to consult with an endodontist if you suspect something's going wrong.
Good. So that takes me to my next question. What's the difference between a dentist and an endodontist? And when should I see an endodontist? Do I get a referral from my dentist, or do I do this on my own? Tell us about that.
Well, first of all, an endodontist is a dentist who receives an additional 2 to 3 years of training after dental school to specialize in root canal procedures. And that makes us your specialist at preserving your natural teeth. When you want to see an endodontist, if you have any symptoms as far as sensitivity to temperature, like when you get an aching sensation after you drink something cold or hot, or if a tooth is tender to bite on, you want to get that checked out and make sure that an endodontist checks that for you to see if you need a root canal. And you can locate an endodontist in your area by visiting findmyendodontist.com.
Okay.
But you can also ask your dentist for a recommendation.
Endodontists, does insurance cover those visits?
Typically, yes. It's a common procedure, and most insurance companies cover that. You'd have to evaluate or look at the details of your plan as to what percentage they cover. But yeah, it is typically a covered procedure.
Great. So you're the president of the American Association of Endodontists. Tell us, what does this organization do?
Well, we advocate for patients in saving their natural teeth. And in doing so, we support our members' efforts in helping provide that service to patients. We provide continuing education for our members, keep on top of the science behind what we do, and also increase the public awareness of the options that are available to help them save their natural teeth.
Good. If you want to learn more, you can go to their website. It's AAE.org. That's the American Association of Endodontists. And as you said, Craig, if you want to find an endodontist, what is it? Findmyendodontist.org. Is that correct?
Oh, no, it's findmyendodontist.com.
Thank you.
But the AAE.org does have a section for patient information.
Great. Good. So, Doctor, are there any questions I haven't asked that I should have, or what kind of big message would you like to leave with people today?
Well, I think you covered it. The things to look out for, as I said, if you are experiencing some pain that is sort of unusual, don't let it go and hope that it's going to go away. There's an old saying that ignore your teeth and they'll go away.
Yes.
We don't want that to happen. So if you suspect something's going wrong, get it checked out, because the earlier you address it, the less complicated the treatment's going to be.
Good. Thanks so much for being with us today, Doctor.
Well, thanks for having me.
Good. We've been talking with Dr. Craig Noblett. He's the president of the American Association of Endodontists and the director of the Division of Endodontists at the University of Minnesota School of Dentistry. We're so glad to have you here with us today talking about the health of our teeth and how it really affects our overall health. This has been Jonathan Marks with Go to Health. Remember, you can visit us at gotohealthmedia.com. You can watch us on YouTube or listen to us on 8 podcast networks like Apple or Spotify. If you like what we're doing, please give us a thumbs up or a 5-star review. That helps get the word about evidence-based medicine out to more people. Thanks so much. This has been Jonathan Marks with Go to Health, and as we say at the end of every show, go to health. God bless. We'll see you again next time. Bye-bye. Thank you for tuning in today to Go to Health. You are one of almost 10,000 people per day who enjoy the evidence-based health information offered by our guest health experts. You can watch us on our website and YouTube and listen to us on 8 podcast networks. Be sure to join Jonathan Marks in our upcoming shows each week. If you like our show, please share this episode with your friends and colleagues. You can subscribe to the show, join our email list, send us feedback, browse through the online store, and view our library of over 150 shows at gotohealthmedia.com. See you next time, and remember to elevate your life with Go to Health.